Hello. Welcome to a brand new medical surgical lesson. My name is Jessie Wheatley and I will be facilitating this lesson. Please be sure that you have your notes ready and you have your notebook and you have your textbook that accompany this lesson so that you can follow along accordingly. Thank you for listening to this lesson. This lesson covers a quick overview and review of the anatomy and physiology of the hematologic system. We will focus on the assessment methods for RNs, age-related changes in RN diagnostic test assessment, and nursing implications for this system. By the end of this lesson, you should be able to compare and contrast the hematologic system components such as blood cells, lymph, and organs involved with blood formation and storage. You should be able to understand that this system is important in helping the body meet its need for oxygenation and tissue perfusion because the blood itself is one of the oxygen delivery systems. You should be able to identify clinical assessment findings relevant to each test of hematologic function and the implications of abnormal results. You should be able to understand the nursing accountability and documentation parameters associated with every test we will discuss in this lesson. Now, let's do a quick review of the bone marrow. The bone marrow is the blood-forming or hematopoietic organ in the human body. The bone marrow produces most of the cells of the blood, including red blood cells that we know of, or erythrocytes, white blood cells, and platelets. Each day, the bone marrow normally releases about 2.5 billion red blood cells, 2.5 billion platelets, and 1 billion white blood cells per kilogram of body weight. Imagine that. In adults, cell-producing marrow is present only in the flat bones, which is the sternum, the skull, the pelvic and shoulder girdles, and the end of long bones. So this is an example of a long bone with the bone marrow showing. We have the yellow marrow, the compact bone, and the red marrow. So that's a picture for you to kind of review real quick. And I just want to point out that with aging, fatty tissue slowly replaces active bone marrow, and only a small portion of the remaining marrow continues to produce blood in older adults. Here's another nice picture of the bone marrow. The bone marrow, there's a cross section through the head of the femur looking at the bone marrow here. The bone marrow also is involved in the immune responses. The bone marrow produces stem cells, immature, unspecialized, and undifferentiated cells depending on what the body needs. The stem cells that are produced by the bone marrow, as I discussed, are immature and they are unspecialized and undifferentiated, and they can become red blood cells, erythrocytes, white blood cells, or platelets depending on what's needed in the body. Recall the precursor cells are the committed cells, the next stage in blood making. These cells need a growth factor. An example of a growth factor is erythropoietin for red blood cell production. So we need erythropoietin as a growth factor to produce red blood cells. Now, we're going to quickly review the blood composition. Remember that blood is composed of plasma and some blood cells, like red blood cells, as you can see in this picture here, white blood cells, and there's, the plasma is the liquid part, and then we have the platelets there. Let's go ahead and talk about the four main components in blood. The first we're going to talk about is the plasma, the liquid part of the blood. It is a part of the body's extracellular fluid. It's similar to interstitial fluid that's found between the tissue cells in your body. However, plasma contains other things such as proteins. The three major types of proteins in plasma are going to be albumin, the globulins, and the fibrinogen. That's going to be important for you to know. Albumin, think osmotic pressure. When you think of albumin, I want you to think osmotic pressure of the blood so that plasma doesn't leak out into the tissues. So albumin is going to be responsible for maintaining that osmotic pressure. The globulins are going to have many functions. They're the transporters, they're the infection protectors. Think immune function. The fibrinogen activates to form fibrin. When you think of fibrinogen in plasma, you're going to think blood clotting. So the three proteins we talk about here are albumin, the globulins, and the fibrinogen. The next components I want to talk about are what are referred to as blood cells. The blood cells are going to be the red blood cells, the white blood cells, and the platelets. These cells differ in structure and site of maturation and function, as you recall from your anatomy and physiology in your prior med-surg classes. Red blood cells are erythrocytes. This is what we call erythrocytes. They're involved in oxygen carrying. They're the largest proportion of blood cells in blood components. So the red blood cells are going to produce hemoglobin. If you remember, oxygen dissociation curve, we talked about that in a different lesson. Remember the role of hemoglobin in oxygen carrying capacity. This is an important feature for red blood cells. Erythropoiesis is a very well regulated process. This is a production must balance with destruction. Erythropoiesis is the making of red blood cells. Remember that we don't want to make too many and we don't want to destroy too many. Erythropoietin is produced in the kidneys in response to hypoxia, and key substances needed for red blood cell production are going to be iron, vitamin B12, folic acid, copper, pyridoxine, cobalt, and nickel. Remember that when we don't have enough red blood cells, we're going to have problems with anemia. And we're going to have anemia as a result from decreased function of the number of red blood cells when they affect oxygenation. We refer that as anemia. Okay, let's now talk about white blood cells. White blood cells are involved in the immune system. There's a table in your textbook that I've included in your notes that I want to make sure that you do review that for leukocyte functions, and so that you can know a little bit more than what I cover in this type. White blood cell types have specialized functions, are formed in the bone marrow, and perform actions of protection through inflammation and immunity. This is a big topic. Make sure that you review it if you don't understand it. The next component of blood cells is going to be platelets, the smallest of the blood cells. These are they stick to injured vessels, forming a plug. That's called aggregation. Also, they produce coagulation substances. Platelet production is carefully controlled in the bone marrow as well. Thrombopoietin is the growth factor that's involved in the platelet production. It's stored, platelets are stored in the spleen. 80% are in circulation, 20% are in storage. Lifespan is about 1 to 2 weeks. Lifespan is about 1 to 2 weeks. Let's quickly review accessory organs of blood formation. That is the liver right here, in the spleen right here. The liver and spleen are important and accessory organs for blood production, helping to regulate the growth of blood cells and form factors that ensure blood clotting. Let's look at the spleen. The spleen contains white pulp, red pulp, and marginal pulp. You can review that in your textbook if you don't remember what I'm talking about. The liver produces let's go back to the liver. The liver produces prothrombin and most of the blood clotting factors. Large quantities of whole blood and blood cells can be stored in the liver as well. It stores the extra iron within the protein ferritin. That's important for a nurse to review. I am including a link to a video in your PowerPoint. It's easier to access it in the PowerPoint version of the notes. Hemostasis is the process of controlled blood clotting. If you're not familiar with the clotting cascade, that's what that video would serve to help you. Localized blood clotting occurs in damaged blood vessels to prevent excessive blood loss. Remember that while blood continues to circulate to all other areas, we still have to clot blood where we are bleeding. This function is complex and it balances blood clotting actions with anti-clotting actions. Your textbook talks about intrinsic factors. Kind of like the intrinsic pathway is discussed in more detail. Think of intrinsic factors as factors within the blood themselves that are activate platelets and then trigger the blood clotting cascade. Your textbook has examples. These conditions include circulating debris and prolonged venous stasis. Continuing the cascade to the point of blood clotting requires that sufficient amounts of all of the different clotting factors and cofactors are available. And your textbook also talks about extrinsic pathway or the extrinsic factors, factors outside of the blood that are involved in blood clotting. The most common extrinsic event is the trauma that damages the blood vessels and exposes the platelets to collagen. Collagen then activates platelets to form a platelet plug within seconds of the trauma. The blood clotting cascade is started sooner by the extrinsic pathway because some of the steps of the intrinsic pathway are bypassed. Other blood vessel changes that can activate platelets include inflammation, bacteriotoxins, and foreign proteins. This is important for you to remember. And the processes result in three things that I want you to have as a takeaway. They're listed in your notes. The first thing is platelet aggregation with the formation of a platelet plug or blood clotting cascade. And then the formation of a complete fibrin clot. Fibrinogen is a protein made in the liver. Active fibrin molecules link together to form these fibrin threads to make a net-like base to form a blood clot. Remember that a platelet plug and a fibrin clot are not the same thing. If you have any questions regarding this and you have reviewed the video I've attached to that, please feel free to ask me. This was just a very quick overview of clotting, hemostasis, and what you need to know as an RN. It is important to remember that whenever the blood clotting cascade is started or initiated, anti-clotting forces are also started. The clotting cascade limits clot formation to damaged areas only so that normal blood flow is maintained everywhere else. Two types of actions are happening in anti-clotting actions. First, we have an action that ensures that the activated clotting factors are only available in limited amounts. Anti-clotting substances include protein C, protein S, and antithrombin 3. If you have any questions about that, it does go in detail in your notes. The other is the action of fibrinolysis that prevents enlargement of the fibrin clot, so we do not have problems from blocking the blood vessel. Next, I want to quickly discuss differences that you may note that are associated with aging and other human factors as you take care of patients in regards to the hematological system. You need to remember and understand that the effects of aging and gender on red blood cells and hematocrit and hemoglobin levels. As bone marrow ages, it produces fewer blood cells. The total red blood cell and white blood cell counts are lower among older adults. That's important to know. Lymphocytes become less active to antigens and a loss of immune function. Antibody levels are lower and respond more slowly in older adults. The white blood cell count does not rise as high in response to infection, and hemoglobin levels in men and women fall after middle age. Another thing I want to talk about is at all ages, females have lower blood cells counts than males, but the difference is greater during the menstrual cycle. As an RN, factors to include in a hematologic assessment of the patients, you need to look at the liver function. You need to look at the presence of known immunological or hematological disorders. So you want to note those. You want to look at their current drug use and how it impacts the hematological system. You want to look at their dietary patterns and their socioeconomic status. Because the liver makes clotting factors, liver disease may impact clotting. It's important for you to remember that. Previous radiation therapy for cancer patients may result in post or permanent impairment to the hematologic function in marrow forming bones or in the radiation path. It's important to remember that. Information about occupation, their hobbies, and their location of housing may indicate an exposure to agents and chemicals that affect the bone marrow growth and hematologic function. You want to teach these patients to avoid unnecessary contact with the environmental chemicals or toxins. If contact cannot be avoided, you want to teach these patients to use safety precautions. You want to instruct patients about the importance of eating a diet with adequate amounts of food that are good sources of iron and folic acid and vitamin B12. In RN physical assessment, you want to include body systems because all the body systems because blood problems cause oxygen delivery to be less than what is needed for normal perfusion. The most common of hematologic problems is fatigue, so the patient may present with fatigue. Let's do a quick overview of lab assessment and what you need to know about labs. Remember that in hematologic disease, the most definitive signs are often in the lab test results. Look at the hematological lab assessment profile provided in your book so you can review what you want to look at. We know that a peripheral blood smear provides the most important information on the sizes, the shapes, and the appropriate proportions of the different blood cell types within the patient's peripheral blood. We want to look at a CBC with differential. It includes a number of studies. We want to look at the red blood cells, the white blood cell count with differential leukocyte count, and hematocrit and hemoglobin levels. We want to look at the hematocrit is calculated as a percentage of the red blood cells in the total blood volume. Remember that the hemoglobin is the level, the amount of hemoglobin in the blood. Reticulocytes are immature red blood cells. In case you didn't know that, an elevated reticulocyte count indicates that the red blood cells are being produced by the bone marrow at a faster rate than they can mature. An elevated reticulocyte count without a precipitating cause usually indicates health problems, so you want to note that. Hemoglobin electrophoresis detects abnormal forms of hemoglobin, such as hemoglobin S, that is found in sickle cell. A Coombs test, both direct and indirect, are used for blood typing. You can also have the patient have drawn a serum ferritin level, a transferrin, and a total iron binding capacity, TIBC. This is important because it shows abnormal levels of iron and where the hematologic iron-related problems are coming from. The capillary fragility test measures how easily capillaries are damaged. And we have also, I want to talk about the bleeding times, the partial, the PTT. You're familiar with that. Platelet aggregation, or the ability to clump, is tested by mixing the patient's plasma with a substance called ristocysteine to observe the degree of clumping. Let's talk about imaging assessment. In assessment of the patient with suspected hematologic problems, you can use radioisotope imaging to see what the bone marrow looks like, looking for sites of active blood cell formation and sites of iron storage. That uses radioactive colloids are used to determine the organ size, liver, and spleen function. You may also have a bone marrow aspiration biopsy done. I want to point out a few things about a bone marrow aspiration biopsy that I want you to kind of go over. You want to verify the patient having the bone marrow aspiration or biopsy that has signed an informed consent. You want to support the patient during the bone marrow aspiration biopsy procedure as the RN. The nursing response priority after a bone marrow aspiration of biopsy is the prevention of excessive bleeding. You need to remember that. You want to check the needle site at least every 2 hours after a bone marrow aspiration biopsy has been done. You want to apply an ice pack to the needle site after a bone marrow aspiration biopsy as ordered. The patient is going to go home. You want to teach the patient and family when and how to assess the site for bleeding and when to seek help. You want to instruct the patient to avoid activities that may traumatize the site after a bone marrow aspiration biopsy. Ask the patient about the activity level, whether they are satisfied with their energy or what's going on. Explain all procedures related to the hematological function, restrictions, drugs, and follow up to the patient and family. Thank you for listening in to this lesson. I hope you have enjoyed this quick review of the anatomy and physiology of the hematologic system. I also hope that you understand the focus on assessment methods, age-related changes, our diagnostic test assessment, and nursing implications for these patients. For questions about the lesson or the corresponding notes, please feel free to email me. Have a wonderful day. Thank you.